Okay, let's look at chapter 10. This chapter is about preventing and controlling infectious diseases, and I know that as a HIM professional, you're not going to area like nurses, doctors, laboratory techs. You're not going into that environment. However, we need to think about what we're talking about in chapter 10 because it affects all of us, especially in this current state that we're in. As at the time of this recording, we're in a pandemic. So, of course, all healthcare facilities are on high alert for the things that we're talking about in Chapter 10. So it's very much on the forefront of our minds, a whole lot more so than it was a year ago. We began talking about, starting out in Chapter 10, about, over the years, there's been so many different diseases, bacterias, viruses, things like that that have affected us. And of course, we've learned through them and developed ways to control them somewhat, not necessarily eradicate them, but control them to a certain degree. For example, there's not a cure for AIDS. However, scientists have developed means for controlling, and it's not necessarily a death sentence like it was in the early 80s. But anyway, starting out on page 176, there's a term there, multiple drug resistant organisms. This is, an area of concern whenever the medications that we have do not take care of the bacteria. When we have those types of bacteria called MDROs, that is a concern because they're resistant to antibiotics. Now, we go on to talk about the fact, and I'm a little bit further down on that page, that there's a statement there that says currently the most effective means of stopping the spread of disease through education, prevention measures, and sanitation procedures. Of course, like I keep saying, the time of this recording, we're in the middle of being hyper aware of, different things that we can do in our own homes, much less in a healthcare facility to help control things. And we're going to talk about a lot more as we go through the chapter. Another interesting statement to me, because I enjoy historical information, but in 1865, Joseph Lister was the one that determined or discovered that carbolic acid used during surgery could reduce infections after surgery. Could you imagine before the late 1800s that, something as simple as a wound, a small wound on your foot would be a death sentence because it could become infected, and there wasn't a lot of things out there that could help fight the bacteria. So anyway, we live in an age now where we have so many different medications that can help. All right, now let's move on to the top of page 177. They talk here in this paragraph about various organizations that provide guidelines, also do inspections as well. The CDC is an organization, we know that term very well, Centers for Disease Control. Also the Association for Professionals in Infection Control and Epidemiology. Again, they offer guidelines and do a lot of research into these different viruses and whatnot. Also, OSHA. Most of us all heard of OSHA, the Occupational Safety and Health Administration. OSHA kind of looks at a lot of different things, not only from structural things like ladders and equipment and things like that that employees use, but also we're talking about it from a safety standpoint of things like bloodborne pathogens. And so OSHA has a hand in that to ensure that employees are being protected. And if an organization doesn't follow the rules and guidelines of OSHA, then they are subject subject to be fined. So most employers, or probably all employers, are very familiar with OSHA and have to consult with OSHA as to what they should be doing to protect their employees. If they don't, then they could risk potential monetary fines. Now, I want to the PowerPoint presentation in this first slide, kind of look at why this chapter and this information is so important. And let's look at the 3 bullet points there. Infections and infectious disease processes play a prominent role in the management of quality and performance in every healthcare organization, whether it be a physician's office, an inpatient facility, outpatient facility. Whatever it is, there is a constant focus on making sure we have the PPE, personal protective equipment, things are being sanitized correctly, instruments are being sanitized correctly, and there's a tremendous amount that goes into that. Any of you that are listening to this that have been in a healthcare field, you certainly understand that from, every instrument that's used, walls, the floors, everything touch could potentially have some sort of bacteria that could be detrimental to a patient. Consumers avoid healthcare organizations that have high rates of what we call healthcare associated infections. You'll see that term used throughout the chapter a lot. In other words, when a patient comes into a hospital, if they enter that hospital with no signs of infection, but then 2 days later they develop an infection, that's a concern, whether it be a UTI or, develop pneumonia while they're in the hospital, or bed sores that become infected. When those things happen, it throws up a huge red flag for an organization. And from a consumer standpoint, we're going to avoid a facility that has that reputation. So very important, not only to provide the best care for the patient, but also from a PR standpoint, as a facility, we don't want that reputation. Financial and emotional costs to patients and facilities are increased when care is extended because of unexpected infections. So kind of what I was just saying, that when you, as a patient, you enter the hospital and then a few days later you develop pneumonia, well, that extends your stay, extends your financial burden, extends the stress to your family. It causes a chain reaction that just gets worse and worse and worse. Okay. All right, now over on page 177, about the middle of the page, we're talking about this term called healthcare associated infection. And like I said, that's an infection that develops after a patient is admitted to the hospital. In other words, if, like I said earlier, if they are admitted to the hospital with no signs of infection, 2 days they develop some sort of infection, then that's what we call a healthcare associated infection, and they deem that as what we call a sentinel event. A sentinel event, to give you some examples, would be surgery was done on the wrong extremity, or the patient fell because and did damage because they did not have the proper monitoring, or so just very unexpected, not planned, devastating events. And so a HAI, healthcare associated infection, is classified as what we call a sentinel event. And so whenever there's a sentinel event, people have to be notified, and the infection prevention and control team is one of those groups that have to be notified of a healthcare associated infection, and therefore, the research has to be done as to why this occurred. So it's a very intense process. We don't want it to happen, and if it does happen, then we have to do the investigation to determine why it happened, what could have been done to prevent this. Okay, so a little bit further down on that same page, the IPC, Infection Prevention and Control Team, must report data to several agencies. Now, if you flip over to the next page, they have a table there or a document that is the Utah reportable diseases. And every state has one, and you see up there that you've got diseases that have to be reported within 24 hours of a suspect diagnosis, and then another group of diseases that have to be reported within 3 working days of identification. So certainly COVID is now on that list. It wouldn't have been on there a few months ago because it's a novel virus, it's new, but I'm sure it is now listed on every state's reportable diseases list. But again, that's a document there that would be very, what's the word I'm looking for? Something that the infection prevention and control team are very aware of for their facility. They continue talking about that the health departments need to be notified of these issues, diseases. The CDC offers guidelines for disease management. And then also a little bit further down in that last paragraph, there's an important statement there that says, in summary, the prevention and management of infectious diseases is an organization-wide performance issue that involves every area of the facility and affects every employee, every medical staff member, every patient or client, and every visitor. So not only is it important to protect the patient, but also visitors to the facility as well. And of course, like I keep saying, in this COVID situation we're in, you see that now that people can't go in and out of a hospital like they could 6 months ago. They're very limited. So not only to protect the people that work there, but also to protect the outside people, the visitors, family members, etc., from further exposure. All right, let's go over to page 179, and I'm going to go ahead and start into the steps to success, and there's several of them that are mentioned here within the chapter. And the first one is I'm going to pause for just a minute. My husband has decided to do weed trimming right outside my window. So y'all hold up just a moment. All right, sorry about that. All right, so starting on step one, the first step, and this again is the steps to success, and there's let's see, 1, 2, 3 of them that are mentioned here. So let's go through these, and this is not difficult information. It's information that is kind of what I would consider some common sense information, but we're going to look at the bottom of page 79, and the first one is control infection through the use of standard precautions. These standard precautions can be defined as the use of infection prevention and control measures to protect against possible exposure and infectious agents. The concept behind these general precautions is that every individual encountered, every patient, everybody that you encounter in the setting should be treated as if they have an blood-borne pathogen disease. So we can't just look at a patient and just because they're, nice and fixed up and look attractive or whatever you might say, they don't look like they have a disease. We have to assume that they have a disease. No matter what they look like on the exterior, you cannot know what's really going on with the body itself. It says blood-borne pathogens such as HIV, Hepatitis B and C are transported through the contact with infected body fluids such as blood, semen, and vomitus. So it's not a pretty word. But anyway, so those things have to be dealt with. Again, you have to deal with every patient by wearing gloves, protective garments, face shields, whatever the case, whatever is to protect yourself. So nothing should be handled in a patient's room or with a patient without wearing some sort of protective PPE, especially gloves, a gown, those sorts of items that are provided. Okay. All right. Now, if we go on over to the top of page 180, it says these precautions apply specifically to diseases such as tuberculosis, vancomycin-resistant pneumonia, and SARS. Information regarding these precautions can be found on the CDC website. And, you know, hygiene guidelines that the World Health Organization recommends to the CDC, implement guidelines to prevent healthcare-associated infections due to multi-drug resistant organisms in acute care hospitals, implement guidelines to prevent central line associated bloodstream infections. In other words, whenever a line is inserted into the heart area, this is a pretty invasive procedure, and you know, just like a catheter could hold some minute amount of bacteria that can cause an infection. So things have to be sanitized and handled very carefully. Implement safe precautions for preventing surgical site infections. Of course, when the body cavity's opened up, it brings on a potential for infections. Implement evidence-based precautions to prevent indwelling catheter-associated urinary tract infections. This is a common thing when there's a lot of patients that, especially when they have surgery or won't be mobile for a little bit of time, they insert a catheter because they cannot get up out of bed, and the potential for UTI infections is greatly increased with these. Okay. You know, just to give you an example, my son, when he was 13, had an appendicitis that had ruptured and had surgery. Everything looked good. He was in there on, you know, some pretty heavy-duty antibiotics for a week, got out. 3 days later, he developed an encapsulated infection. Thank goodness it was encapsulated, and had to go back in for 7 more days and had to have drained. So, you know, I'm sure that the hospital did everything they knew to do. He was on heavy-duty antibiotics for 7 days, and still, just I guess, minute amount of infection was still there, and caused it to have to start all over again. So it can happen. All right, step 2. Let's see if I'm up here. All right, step 2 is conduct ongoing infection surveillance and epidemiology investigation. So there's several parts to this particular step, and the first one there being healthcare associated versus community acquired infections. So we've already talked about healthcare associated infections that develop after a patient goes into the facility and was the result of something not going correctly inside the facility. You know, maybe they weren't turned enough and developed a bed sore. Maybe, you know, their feet were not dealt with correctly and they developed heel ulcers. You know, for whatever reason, developed pneumonia or other infection. That's healthcare associated. Now, community means that they will have come in contact with it prior to, and we see that a lot happening with COVID. However, COVID could be hospital or healthcare associated. if exposure happened within the facility. However, most of it is happening outside and then comes in. So, for example, they give the example in the book that a patient comes into the hospital and 2 days later they show signs of, I think it was measles. Well, there's a 14-day incubation period on that, so they must have been exposed prior to coming into the hospital. So, letter B is talking about surveillance of employee health and illnesses. It says a different aspect of infection surveillance involves employee health and illness tracking. So anybody that works in a healthcare facility is susceptible to coming in contact with different infections. However, also there's a concern of bringing it in from the outside. So that's why, all healthcare workers have to have certain vaccinations, have certain testing that's updated, certain testing they have to do from time to time to make sure, whether it be, varicella, chickenpox, or, other things that they have to be checked for. I know our students that do the practicum experience where they go out into healthcare facilities have to have all these screenings done and vaccinations done and before they can actually go work on these sites. So another thing they talk about at the top of page 181 is looking at absenteeism of employees in the healthcare field. Tracking that information. Why is this employee out? Were they just, had a headache or some sinus issues? Okay, fine. But if it's something more than that, we need to know, what's happening with that employee. So they're tracking that information as well from a healthcare standpoint. Surveillance of facility vaccine programs, like I was just talking about, facilities will make sure that their employees have the proper vaccinations and are up to date with all those vaccinations. And very important that that information is tracked. So as a healthcare employee, yeah, I'm sure it can be frustrating to have those different things tested on us, but you have to have the understanding of how important it is to protect the employees and the patients. Okay. Okay, I'm just looking at the slide here to make sure. Okay, let's continue on. Looking at letter D, surveillance of the healthcare environment. Monitoring the healthcare environment is another aspect of infection surveillance. Facilities that have laboratories on site must meet all the inspection processes that go into that. They actually, swab different surfaces to make sure there's no signs of any kind of bacteria. So this is something that facilities are constantly doing, is hopefully constantly doing, is checking behind the cleaning processes to ensure that things are being cleaned and disinfected and as much like they should be, whether that be counter surfaces, computer keyboards. Oh my goodness, if we all swabbed our own computer keyboard, I'm sure it would probably startle us. And it's something that you need to consider, all these surfaces that we touch. I try to go through my classroom and use antibacterial wipes to clean the keyboards as often as I can, because there's a lot of things. If you watch people, they're constantly touching their face and then touching keyboards and mice or coughing into their hands and then putting their hands right back on their keyboards. So it can be a pretty nasty situation if you step back and think about it. Just watch people and the things that they'll do and then touch. Whether it be rubbing their eyes and then touching a surface, or vice versa, or coughing into their hands and then touching a surface that a lot of other people are going to touch. So I know a niece of mine used to work with 4-H, and she told us about an activity that she did with her kids, and it was called a glitter activity. And they all got to play with a little bit of glitter. And then a little while later, they did a survey of the room, and that glitter was way beyond where the kids were playing with the glitter. In other words, that glitter is now on surfaces all over the room, because what they were trying to explain was how bacteria and viruses and things can be spread so easily with just touches. And so that was just kind of made them aware. But anyway, it's that way. With the things that we touch. So anyway, what I was talking about was the actual healthcare environment and the cleaning processes that have to be done and constantly monitored within the facility. Letter E was surveillance of food preparation areas. Definitely a big part of an inpatient facility. And different refrigeration units have to be monitored to make sure that they're at the proper temperature. Things have to be wrapped up in a certain way, stored in a certain way to prevent any kind of rodents. I mean, you can have the most pristine facility in the world, and you might have ants, or other little varmints can possibly get in. It's the world we live in, but we try to do everything we can to protect food and product and things like that. So kitchen areas are a big thing to be monitored. The water temperatures for the dishwashing machines have to be a certain temperature to kill and properly clean the things that go into them. Okay. All right, let's look on over at step 3. Of these steps to success. And step 3 was all about conducting educational screening programs. And that was one of the things we talked about at the first of the chapters. We have to educate our employees about, the proper things that have to be done, why we do these things. Looking at the slide there, it says evaluate all the means of transmission of infection throughout the facility and develop educational programs that promote disease prevention. The TB testing, hand washing campaigns, which we see a lot now, influenza vaccine programs. I'm seeing a lot of, as we start heading into the winter months, a lot of commercials and advertising for flu vaccines. Hepatitis B vaccines for high-risk employees, sterile technique in services, needle stick prevention programs, universal precaution education is mandatory for all employees. So all employees need to be aware of these things. Just because you're not a nurse or not a surgical tech or not a physician doesn't mean that you shouldn't be aware of the proper ways to prevent disease transmission. They also talk about tracking exposure to bloodborne pathogens, such as, a nurse that accidentally was needle stuck. They want to monitor and check that nurse over periods of time to determine were they infected. So, they're checking these things constantly. Okay. All right, let's move on over and start looking at flowcharts. And flowcharts are a visual illustration. It's a tool to help us walk through complex processes. So we see flowcharts in a lot of areas. People that work in computer programming, they learn right out of the gate how to develop flowcharts, because that's how they have to think as they're developing the programming that goes into these software programs to do the things we need them to do. So we need these visual representations of, okay, this is the first step. If this, then go this direction. If not, let's go this direction. And then you keep asking for a series of, okay, if this, go this way, if this, go this way, and then this step, and so on and so on. And so from a flowcharting aspect, from a flowchart development aspect, there's certain symbols in the flowchart process when you construct a flowchart called icons that mean certain things. So if you look over at page 185, 186, 187, I think it goes further than that, 188, that is a one continuous flow chart. And you can see that a flow chart can get quite extensive from where it starts. And this particular flow chart starts with the nurse triage of patient needs. Okay, the second thing is need urine specimen, yes or no. If no, then wait for the physician. If yes, then, well, who will contact it? Where will it be collected? That sort of information, and then go from there. And then the lab gets involved or the nurse gets involved, and then you see that the process continues on and on and on. So what I want to do is look at the different flowchart symbols or icons and look at what they mean. So this is important, so make sure that you study this information and be familiar with what these flowchart symbols mean. So I'm just going to use the slide presentation here, and the first one is the rectangle that represents periods in the process when actions are being performed by human participants. And if you look at our little flow chart there, you can see the triangle, or not the triangle, I was looking at a triangle, the rectangle that says the nurse triage of patient needs. That nurse is triaging that patient. Okay. The next symbol is a decision icon. This represents the points where in the process at which participants must evaluate the status of the process. We're trying to make a decision here. So if you look at the flow chart, do we need a specimen? Yes or no? That's a decision that has to be made. And you're going to go one way or the other. Okay. The next symbol that you see is a connector icon. This represents a point in the flowchart description of the process where the analysis skips to another common point of the process. So if we look at our image on page 185, you see the number 1 there is a connector icon. It's referring you to another location in the flowchart process. Okay. And if you look on page 2 or 186, you can see that that's where the number 1 continues up there, that the medical doctor assessment of patient condition needs. So you see that, do we need the urine specimen? No, wait for the physician. So it's telling you there out to the left that the connector is now going to the number 1. Well, if you flip on through the flow chart, well, number 1 picks up there with the medical doctor stepping in. Okay. All right, now another flowchart symbol, the terminator icon. This marks the end of the process. And so if we, let's see if we have an end to the process here. If you look all the way over at page 189, show you at the very end, the process is complete. That means we're done. Nowhere else to go. And then the last flowcharting symbol there is a manual input icon. This represents points in the flowchart description of the process where the participants must record data in paper-based or computer-based format. So if we look at our flowchart, and if you flip with me to page 188 at the bottom or at the top, you can see there where multi-stick positive for blood bacteria, white blood cell count, okay, then we're going to document, whether it's yes or no, we're going to document. If it's no, then document the urine analysis results in the patient record. If it's yes, the house staff completes UA lab requisition. either way, yes or no, there's got to be documentation that is done. So that's what that symbol, that manual input symbol, represents. So the flow charting symbols are something that you could potentially be a part of if you're asked to be a part of developing a process, not necessarily for infectious diseases, but some process involved in the HIM profession where you're looking at the steps taken and doing certain things, and you develop a flow chart to visually see every single step. And that's a good way from a performance improvement viewpoint to look at where we have inefficiencies or where we could change something to make it work better, or maybe we need to add a step to make things work better. So that's where flowcharts are helpful. So flowcharts are not just limited to what we're talking about here in Chapter 10. Flowcharting can be done in any aspect of a job performance. Okay. All right. So that is chapter 10. There's really not a whole lot to chapter 10. Basically, it's about, you know, the extreme steps that we take from a lot of different viewpoints, whether it be just the patient, the actual facility itself, you know, surfaces, equipment, whatnot. How are we controlling infectious diseases? How are we trying to limit as much as humanly possible the chance of a patient or employee contracting some sort of infectious disease? If it can be prevented, we want to do whatever we can. So it's a constant process to improve. That's what this course is about, performance improvement. And if our numbers, we generate reports, show that we're not doing as we should, then that's where we start back with the team aspect and looking at things and doing, you know, charting and brainstorming and figuring out what we can do to improve this particular performance. Okay. All right. That is chapter 10. So thank you so much.